volunteer at Macquarie here for about 5 years. I work in the clinic and also day surgery. Might add the day surgery, it's a non-surgical role, just in case people are worried. I've also been volunteering at the Macquarie Uni through the graduations. Also done the Hawks program a couple of times.
I've had several different roles. I was at the clinic initially. Then when COVID struck, we were with patients when they were being vaccinated. Following that, with Jane Goodwin-Moore, the volunteer coordinator at Macquarie Uni, introduced us to the ward work. So that was on the orthopaedic ward, which was just a fabulous experience.
Primarily, I'm assigned to the Orthopaedic Institute, meeting and greeting patients from check-in, taking them up to level 5, introducing them to their pre-op nurse, weighing and measuring them, chatting them on the way just to ease their entry into the sometimes daunting side of visiting a hospital. The other side of my volunteering is that I'm a member of the Consumer Advisory Committee here, but my main role here is being with people, trying to ease their transition from the road into the hospital and making them feel comfortable.
For me personally, it was, I'd retired and I needed some social interaction with people outside of being at home. When you work, you're involved with people every day, and I quite enjoy the social interaction I get from volunteering.
I've actually got a history of many years of managing medical practices, and when I actually decided to work no longer, I was looking for something to fill that need, to be kind. Human kindness should never ever be underrated, and I've fortunately found that at Macquarie University. When a patient comes to hospital, I always remind myself they actually don't want to be here. So that motivates me because I see just you give a little bit of human kindness to them, a little bit of attention, and you can see they're really quite surprised, and quite often they'll just say, gee, I thought this was going to be difficult, but you've made it so much more easier.
What led me to volunteering was that I was a patient here and I was treated so well. I was very impressed with the equipment, the staff, the facilities, even the food. And I wanted to promote Macquarie University Hospital to other people so that they might have the same experience I had with the hospital.
I think the impact on patients with the volunteering that I experience at the hospital is gratitude that there are volunteers, and the number of times that patients have said to me, would you like to come and visit me in rehab? I go, look, I'll certainly make an effort to do that. They often say how grateful they are, and also they quite often, I've given a few patients contact numbers for Macquarie Health because they said, you know, I might want to volunteer once I'm out of here because this has been such a really good experience.
People are coming to me for assistance, guidance, maybe a very simple thing of just where do I need to go to meet my doctor, or am I in the right place? I do quite enjoy the ones who walk into the clinic, particularly they look at you and you can see they're not really sure where they are, and I just go, can I help you?
The people that I meet each day all have various levels of anxiety, and if I can ease those fears and anxieties of just one person coming to the hospital, that person might go out into society and tell their family, look, it wasn't as bad as I thought it was going to be. So I'm hoping you plant a little seed of confidence in that patient and they take out that experience and it grows on other people. As for my own self, I hope it doesn't sound selfish, but I get a great kick out of what I do. I really enjoy making people smile and having them sense that they're cared for, and that gives me a great sense of giving back to the community and society in sort of repayment for the way I was treated.
I think my mental health has improved. It was a bit of a challenge when I had worked for 40 odd years and then suddenly had nothing to face each day. So volunteering helps me from that point of view. It takes me out of the home environment into a very different environment to the one that I was used to. It also brought the opportunity for me to use some of my personal skills that I'd learned through many years in business and apply those in a very different environment.
maybe not improving my health, but it maintains a sense of self-worth and a sense of self-value, that you feel that you've done something that might benefit your fellow man. And that's it's intangible, I know, you can't measure it, but it's certainly a sensation or a sense that I have gone away from here, maybe having helped some people.
Gratitude. Gratitude for being relatively well, because you see such a diversity of complaints with patients, and you realise that if we can volunteer and ease a little bit of that, but at the same token that we're relatively healthy. They've gone through a lot to actually be here, and seeing their response to their dilemmas and their problems, a lot of them are really very grateful just to actually be here.
We all think volunteering is giving of your time and doing stuff for nothing, but in return, the return on that investment is multiple, it's manifold. So I think if you're thinking of volunteering, give it a try and you will sense the experience of being valuable to society, and that's something that money can't buy.
Approach it in an empathic way. It's something that you gain personal improvement from.
Just a smile, a little bit of a personal approach can make such a significant difference to just that initial visit. Sit down next to them, have a little bit of a chat. That really is quite significant. But also, I think, have a passion for it and have a sense of basic human kindness, because believe me, it goes a long, long way and it is greatly appreciated by the patient.